We want to give you guys some things about medication. We want you guys understand and also work. How can I say, like, have a good communication and also understand the work scope of work of the pharmacist to understand how they at least about something they're working and also about some thing related to medication. And we are a doctor, so we need to work well with the pharmacist, right? Even the nurse. So welcome, Ms. An Bùi. So Ms. An will be the host today. So yeah, I will let him become the host, and I will.
Thank you, Dr. Thương, for your kind words and great introductions. I just have this case for you guys to. But this case is not like it's not going to be focusing on like pathologies and or the condition of the disease, but rather we will focus on how to look at the prescription of one patient and how we will educate with the patients and how to take medicine and we was based on her like conditions and to see what we would choose like the appropriate medication for her age, for her conditions, and also for her disease. To break the room, could Dr. Thương help me with that? Or
Yeah, I will do it. Don't worry. So can you guys guess about what we will discuss today or what the case today will be?
So based on I think you guys already have a sneak peek for the patient history, right? Like the age and like the chief complaint, right? So So with a patient with for elderly patients, polypharmacy is one of the like the most like common problem for pharmacists and also for doctors, because like they will have like they have like the change in their bodies, like with the age conditions.
Okay.
They will also have like a lot of like chronic disease. So it also with is like with like how the body responds to the drugs and vice versa. So the main thing today is it's going to be her age related to the medications.
All right, thank you, Mr. Ang. So, all right, you guys ready to come to the room today? Ready? All right, good. So let's start. See you guys next 30 minutes. All right, 30 minutes. What makes you feel nervous, Ang?
Because I have no idea what happened with him.
Okay.
Yeah, with her actually. Yeah.
So I feel like the doctor today kind of very afraid about this case because you don't have any suggestion in your mind or even the diagnosis, or kind of like that. You feel very confused, right?
Yeah, I'm so confused that it might be because of her age, or because he also she also take various type of medication that I'm so confused that it related to her side effect of medication.
Yeah, that's good.
I think Dr. An is doing great. Like she has like kind of like a skill to gather all the patient information. She has like I think she has like a great sense of a doctor.
Thank you.
We have a new member today, right? Mr. Dũng, Vũ, sorry, Vũ, you are new member, right?
No, I joined from the last 2 weeks.
Okay.
I remember. I was with you.
Yeah, I been with the same room with Mr. An.
Yeah, with Dr. Viet as well.
All right. I say, Doctor, sorry, Mr. An, you will become the host and just maintain the case. Yeah.
Okay, so can anyone like summarize, like just sum up, like what the medical history of this patient for me, please?
Shortly.
Yeah,
short-
just like what you just gather from the patients. Like, could you tell me, like all
Did I?
the info that you guys can, like
Go ahead.
maybe doctor, like who's have like.
Dr. An, yeah, go ahead.
Yeah. So I just summarize some information about her medical history. Here, she's take 5 to 6 medication, including warfarin for her atrial fibula, diagnosis 2 years ago. She also diagnosed with osteoporosis. So her doctor said that she has the risk of bone fracture, and she also take allergy medication for her runny nose, and Tylenol and donepezil for her dementia, and metoprolol every morning, and also her herbal medication. That's all.
Yeah, that's like the medication list. Like, what about like all the symptoms and like pre-existing condition?
Can I do it?
Sure, Dr. Thảo, right?
Okay, yeah.
Yeah. Go ahead.
So she's a 87 years old female who came to the hospital with the complaint of the dizziness when she stand up.
Yeah.
And she can't control her bladder every day. It happened a long time ago, about several months, and it like the disease happen all the time, and nothing can make it better, except when she sits down, and she also can't control to pee every day, and she had to wake up at night to pee for about 2 to 3 times a night, but the urine color is normal. And yesterday, when she woke up at night to go to the toilet, she felt disease, and then she felt and broke her hips. So now it hurt a lot. It hurt a lot, but still have mobility.
As since I asked her, she says that she also have some diarrhea and feel and have blood flushing and sweaty.
Anyone would like to complete the rest of the patient history? Is that enough?
She also says that she have menopause at around 60 years old, and diagnosis osteoporosis from 7 years ago, like at age 80.
Yeah.
And no alcohol, no smoke. Husband passed away 6 months ago, and live alone.
Good. Anything else? Anything else you'd like to add to?
I think my patient has orthostatic hypotension by autonomic function, because my patient, she 87 years old, and she said I wear my underwear every day, and she has Alzheimer. So I think she has autonomic function loss, and she have dizzy when she stand up. Dizzy, this is when she stand up. Yeah, and she not nausea or vomiting. No tiny. Her blood pressure sitting 118/72, and when she's standing year 100/60, and it means she has a hypotension. Hypotension it means when loss 10 millimeter high diastolic.
When you drop the blood pressure, right? The blood pressure is just drop.
Yeah.
Yeah.
So I think she has orthostatic hypotension.
Yeah. And also, yes, she also has Alzheimer dementia.
I did
Okay.
want to.
Okay.
Did even want to check to exam rectal examiner because I think if the patient is a male, so he might be urine incontinence because of
Okay. So I'm just gonna start this his presentation today. Dr. Thion, so should I show them the lab test or I just ask them?
No. Now you can
Summarize
the case again about all the symptoms of the patient and for make sure everyone know well about.
Yeah. Thank you.
I feel like I'm reading about what the lowest, the longest version before like MS DOS like about another software for the IT kind of like this. Oh my god. All right, that's really nice.
Yeah. So I'm just gonna just go quickly about the patient profile and symptom complaint. Like we all know, she's a female at 87 years old with the cheek complaint. She gets so dizzy when she is stands up, and she just wet her pants. She doesn't have any control of her bladders. So she went with her daughter to complain about dizziness and urinary incontinence. So after that, she will refer to a pharmacy to consult about the problem with the multi drugs and the side effect of the medications. At the onset is last night after getting out of the bed to use the bathroom. With all the symptoms, she felt fainting and loss of consciousness. She stated that her hip is hurting when she fell on, but she still had mobility. And she admitted being very blue. I think she has some kind of depressions and has got crying spell when she discusses about her husband who passed away 6 months ago. With another for the past medical history, she has osteoporosis. She also had non-valvular atrial fibrillation, but no history of a venous thromboembolism. She also had runny nose, which is indicated with the seasonal allergic rhinitis. And she was diagnosed with Alzheimer's, the onset of Alzheimer dementia 2 years ago. She has, for surgery, she has one Syrian section. She has she doesn't aware of any a medication allergy. She hasn't been to the hospital except for the C-section. For the her prescription is it has a lot of drugs. The first one is Coumadin with the active ingredient is warfarin. She takes 2 milligrams for Monday, Wednesday, Friday, and Sunday, and for 4 milligrams. Everyone see it clearly, right? Yeah.
Yes.
On Tuesday, Thursday, and Saturday, all of them would be by mouth. For Summers is with the active ingredient alendronate, 70 milligram also by mouth once per week. Diphenhydramine, 25 milligram also by mouth 3 days for the allergies, 3 times a day for allergies, and she also takes Tylenol as much as she needed for the pain at the hip. She also takes metoprolol succinate 50 milligram by mouth every morning, and the last one is donepezil 5 milligram by mouth every morning. And recently she also take the ginkgo biloba. It's a herbal medication, but also by mouth every morning to help with the social history. She has lived alone since her husband passed away. No tobacco or alcohol consumption. she also worried about taking medication because she's on a lot of medication recently. Family history, no significant from her parents because they just died because of the natural cause. They just died because their age. Review of the system. The blood pressure when she was sitting is 118 over 72, and was standing when 100 over 60. Her heart rate is 76 beat per minute. It's irregularly. And respiratory rate is 18 per minute. But her body temperature is 36.8 Celsius degree. With the height is 162 centimeters. Her weight is 55 kilogram, and her BMI is at around like 21. She appears to be like a well-developed, well-nourished, no acute distress. About her heart. The rhythm irregular, but no murmurs or grooves. Her neurals is mostly normal except for the MMSE score is 17 over 30 compare. The MME score is 18 over 30 compared with the score 17 over 30 and 19 over 30 last year, and the initial diagnosis. She is disoriented to month, dates, and day of a week. Only I'd be able to remember one of the items after 3 minutes, and display apathy during MMSE. The rest is pretty normal except for the mild sinus drainage. Neck normal, lungs, abdominals is normal. No clubbing, cyanosis, edema, no normal range of motions except for the. And this is
So what the test you want to order for this case? What the workup you want to order? So looking for about your answer, the diagnosis.
Anyone have any idea who's like?
I think the calcium
The calcium.
and
Yeah.
and also
You
the
guys,
INR.
you guys, one people can speak, one person can speak, and others can write down on the. You can based on
Yeah. I will just read it out for you guys for any test that you would like to.
Yeah, go ahead. Go ahead.
Yeah, so for the calcium is 9.7 milligram per deciliter. You'd like to talk about calcium, right?
I think since they have diarrhea, and sweating as well, I would like to order. I think is to check the her CBC. Okay, CBC for her disease, to check if she has any anemia. And also electrolyte.
Yeah.
Electrolyte, because she has diarrhea and sweating as well, and I don't think any else. But okay, I think maybe we should do the X-ray for his hair, because she fell down yesterday, and right now she also have the pain on here.
So we haven't got the X-ray, but that's good. So one of the doctor asked about the INR. So her INR is 3.1, and the ECG is in the rate control for the irregulars.
I have no idea why we want to check her INR.
Do you know about
because she using warfarin.
anything else you would like to?
Yes, we have bone marrow density test result. That's a minus 2.6.
Yeah, T score is like most of the electrolytes is normal. The diarrhea happen it comes and goes, so it doesn't happen like a lot. So like the electrolytes is also, the sodium is normal. The CBC, so we have the PC.
All right, Dr. Mr. Ang, can you share the screen again and show the lab test result, because everyone waiting for that. I think they want to see the result.
There you go. It doesn't have the T score, but it's like the T score is minus 2.6.
All right. So what you see from the lab test here, any abnormal or everything is normal? I know how some parameters you feel a little bit confused, right? But to be honest, that's normal for the lab test. We don't have any problem.
Yeah, could you guys look to maybe like the column number 3? Someone ordered the INR, right? So INR, her INR is 3.1.
All right, so I want to ask about a question about how or why do you want to order INR on this patient? What do you want to looking for?
I just told before because she's have AFib and she's using warfarin.
The honor for the managed about the risk of bleeding the patient. Okay, good. Next, Dr. Mr. Ang.
Thank you. Yes. So this is her for the radiological like image and the result for the ECG. So I'm going to start with so anyone has like any ideas about what is going on with this patient?
Okay, no idea.
Dr. An, maybe like you can just say.
I see in the CT scan result, we have the patient have mild to moderate generalized cerebral atrophy is okay. It might be due to her age. She is 87 right now, and maybe to his elderly patient, or maybe to because she has Alzheimer. So I confused that this is indicate any abnormal condition or just normal.
To her age. Dr. Thương, could you help me with that?
Can you ask the question again? Sorry, I didn't catch.
Oh, so Dr. An just want to ask, like, for the mild to moderate generalized cerebral atrophy, is this like this is something like happen naturally due to her age, or is this like it one of the like
no, it's not normal. It's not normal. That's a picture. That's the something change for the patient who have the Alzheimer's disease, and the outcome of this, their brain become atrophy, and you see like they say that's a mild to moderate generalized cerebral atrophy, so it means have neuron degeneration. At the end of the patient who have the Alzheimer's disease, their brain become like what we call parenchyma, or the brain tissues become like atrophy, and the ventricle the ventricle become like widened. We have like three parts of ventricle, like and they become widened. So that means have the ventricular becomes widened, and like it will be like because of the atrophy of the brain tissue. So that's abnormal. But because patient have the Alzheimer's disease, so that's.
So can we control this atrophy of the ventricle with cerebral atrophy with medication, or just let it processes?
The Alzheimer's disease until now they don't have specific treatment. All of the medication just want to control about neurotransmitter, to decrease about like the accumulate of the neurotransmitter in there, and also want to maintain their lifestyle or their life expectancy. It's not treatment specifically. Make the brain become like decrease about atrophy. So that's very challenging. Until now, they don't have any specific treatment for Alzheimer's disease.